Shakil.
Mm.
Yes, Asma, over to you. You can make a start now.
Hello, everyone, and welcome to the Hive Podcast, where we buzz about the future of healthcare, education, and mental well being. I am Asma, an executive member here at Hive, and I'm super duper excited for today's episode because we have a very, very, very special panel with us. Basically, the dream team of Hive. We joined by the CEO of Hive, Dr. Malik, a big brain behind our global vision. Dr. Umar, our brilliant academic lead at Hive Medical Academy, the man who makes learning actually interesting. Miss Sumbal, a qualified clinical psychologist and project lead at Hive Care. And of course, Miss Aisha, along with her amazing team, the energy, creativity, and the magic behind the growth and outreach of Hive. Thank you all so much for being here. I know everyone is busy saving the world in one healthcare initiative at a time. Now, let's get started with Dr. Malik. Welcome to the podcast, sir. It's
Thank
such
you
a
so
pleasure to have you here, sir.
Thank you so much, Asma, for a great introduction of the team and Hive Medical Academy. I will give you
Thank
just a
you, sir.
brief intro about the Hive Medical Academy, as several people they know that Hive is serving international medical graduates for decades and supporting, empowering them. And Alhamdulillah, we are expanding Hive and our wings are spreading now. So we have added a clinical wing in the Hive Medical Academy. And this is a great news for everybody around the globe because we are trying to bring international standard healthcare facilities at their doorstep, at their own comfort zone, and they can avail international standard medical care at their doorstep at any time. So for the further details, our clinical wing is led by Ms. Sumbal. She is our project lead, and she will be more than happy to answer all the questions, all of our clinical wing facilities, services for the people around the globe. Then we have got Dr. Umar. He is our academic lead, who is have got decades of experience in his field, and he will be highlighting all the academic facilities, the services, all the courses from English OET to PLAB, and even after that, everything. So yes, welcome both of you, our leaders, Ms. Sumbal and Dr. Umar, and they're open for the team for answering, or they are happy to answer any question for them. So I'll pass over to Aisha Butul. She is our executive member, and she will take over from here to answer all the questions from both leads.
I think we might just have to, I don't know if anyone's noticed, but Sumbal has just dropped off. So we just maybe start with
Yeah,
myself.
she's back in.
Okay.
So over to you,
So
Aisha.
we'll start. Okay, so my first of all, my team Javier will start it. The question. Okay.
Assalamu alaikum everyone.
Walaikum salam.
Walaikum assalam.
My question is to for the Dr. Umar, and it is related to Hive academics. So I want to ask, sir, what are the strategies of the Hive Medical Academy for tackling the PLAB 1 and PLAB 2 exams?
Thank you. Great question. So first of all, just a little bit about the academic side of Hive Medical Academy. So our main focus is obviously IMGs, International Medical Graduates, and the PLAB route. However, they are not the only health professionals that we help train and provide courses for. We also provide courses for pharmacists in the UK, various courses to help them advance their clinical knowledge and practice. We also offer courses to nurses who want to move to the UK and various other health professionals as well, including the dentists too. So it's not just about medics, but obviously me having been a medic, our main focus is on the medics and it is on IMGs. So coming to your question about what are our strategies. So our strategies tend to focus around um, assessing a student's or a candidate's strengths and weaknesses. And we do that from the very first time we have a conversation with them. Everybody who registers with us, sorry, has a conversation both with Dr. Shakil and myself. Then, as academic lead, we find out about their background, what kind of experience they have. Are they a fresh graduate? Have they many years of clinical experience? You know, how much have they prepared? What are their own thoughts on their strengths and weaknesses? And then we obviously share our own as well. And then we, together with the student, come up with a plan for how we're going to tackle their approach. And I think that's what sets us apart, sorry, from other providers of PLAB courses and English courses in relation to IMGs who want to come to the UK. It's a very personalized approach. It's very analytical, and that's how we tend to proceed. And it's working well so far.
Thank you, sir. Sir, my next question is also related to my first question.
Okay.
So I wanted to ask that how Hive Medical Academy helps students stay focused and motivated during their lab preparations.
Okay, so how do we help them stay focused and motivated? So we always, as part of our discussions, as part of our preparations, as part of our live classes that we hold for all our PLAB candidates, we focus on study techniques. We focus on the other things that they need to remember as well in order to ensure that they are studying in the best way possible. So getting enough rest, eating well, sleeping well, balancing study with work and with family time. So this is all part of the kind of the DNA of our approach as an academy. But even beyond that, specifically, all our candidates are in study groups in terms of PLAB 1 as well as PLAB 2, as well as our English courses. So we're always checking on them. We are sharing content with them. We are asking them questions. We are encouraging them to participate. So it's a constant knock of of daily or weekly interaction with senior members of the team, including myself, as well as the other students. And all our students know, and sometimes I still can't believe that we do this, but we do because that's the kind of academy we are. Any of our students can contact myself or Dr. Shakil personally at any time with any issue they have. And as I said, that's the type of academy we are, and that's how we try to help them as much as we can.
Thank you, sir. It means Hive Medical Academy guide you in every step of the way.
I believe so, yes, that's what we try to do because we understand that it's not just about passing your exams. It's a much
Mm.
wider experience. It's a much bigger journey. You know, for somebody to move country, to leave their family, to leave a system that they're familiar with and going to a new system that they're totally unfamiliar with. So there's lots of anxieties and concerns and lots of administrative steps along the way as well. So yeah, we try to help in every way possible.
Thank you so much, sir. Thank you.
You're welcome.
Assalamu alaikum, sir. I had a question.
Welcome, Sam. Yeah, please, sure, go ahead.
Can you share any tips or advices for students who are currently struggling with specific subjects or topics in PLAB exam?
Yeah, sure. So for people who are not our students, obviously my first recommendation would be to contact us so that we can help them specifically. For anybody who is our student already, they know we're just a WhatsApp message away, and that's we get daily messages from them. But in terms of general things, I think the key thing is to ensure that you have a good set of resources from which you're preparing, and you don't try to collect all the resources, because there are a lot there. There are a lot of good ones, but there are also a lot of poor ones. So, taking a bit from here, a bit from there, a bit from over there, it can be confusing. So try to stick to one, or no more than no more than a couple, and one of them should be the widely available nice guidelines, on presentations and conditions. And the other one, of course, I would say is Hive's resources. But if there is a particular problem, you need to identify what is the issue. Is it a knowledge gap with the student? Is it an understanding issue, or is it an issue of applying the knowledge that they already have? So it's obviously it's a general question, and my answer is, maybe a bit general as well, but specific things, they need discussion with somebody who understands the topics um, to an expert level. And so you have to seek advice from somebody who's well experienced, who's experienced with teaching, with academics, explaining concepts, breaking down concepts. And so it's all of those things.
Okay, thank you. That's perfect. I think that's a good advice for all the students. I have one more query, if you could answer.
Yeah, sure.
What kind of guidance does Hive Medical Academy offer to the students on creating a strong NHS job application that includes the CV writing and cover letters also?
Yeah. So again, just to unashamedly plug Hive here. As far as we know, we are the only medical academy of our kind who helps with the post-plab route, who actually helps people pass their exams and then actually get a job. And in some ways, the getting a job is the even harder part, because medics are used to studying, they're used to sitting exams. Of course, they have to make some adjustment when they prepare for UK-based exams. There's a change in way of thinking and a cultural shift. But landing a job is competitive. And so what they have to do is they have to prepare well and get advice and support for each step of the application process, whether that's improving your CV, ensuring it's up to scratch, up to standard in terms of what the NHS expects or NHS employers expect. It's ensuring that you are applying for the right jobs. A lot of trainees sometimes apply for jobs that they shouldn't be applying for. Maybe they don't have the experience for yet. And it's also, getting getting coaching, or getting practice in actually in actually how an interview feels, being asked questions by a native English speaker in English, and getting that experience of having to understand what's being asked, and what answers they're looking for. Um, there's these 3 or 4 things that I've already mentioned, and in addition to that, I can't overemphasize the importance of a clinical attachment as well. Actually, having been in a clinical environment in the UK, whether it's in a hospital environment, whether it's in a primary care or general practice environment, actually having experienced that and been surrounded by healthcare professionals who work in the NHS, spoken to patients who speak that funny type of English like I do, and and learning from that experience and using that experience in a job application, as well as, the references that you would get from that. So there's so many things. It's not just one thing. It's not just the CV or the cover letter. It's all of those things. And uh, as I said, to plug Hive, which I'm not ashamed to do, this is covered in our Global Medics NHS program. which is our most comprehensive route to an NHS job. It's also covered in some of our other programs as well, including the PLAB Success Program. And it can be, it's something you can do individually as well, even if you've already completed the PLAB route. So whichever way you join us, that support is available for them candidates.
Okay, thank you. Thank you so much for the explanation. My doubts are really clear now. Thank you.
Thank you, Muktuma.
Assalamu alaikum, sir. How are you?
Walaikum salam. I'm good, thank you. How are you?
It's me, Muzammil Ahmed Khan. I have a question for you.
Sure.
Sir, my first question is, how does Hive Medical Academy help students prepare for NHS job interviews, and what kind of feedback can they expect?
Yeah, so as I said, we actually do mock interviews. We can do 2, 3, or even more. And how we help prepare them is the same way in which we help them prepare for their exams, which is to put them in that situation, to put them under that pressure, and see how they perform. Then, give them positive feedback in what they did well, and then give them constructive feedback for where they need to improve. And we can do that, 1, 2, or even more times, as many as is needed by the candidate, to actually get them up feeling confident and up to the standard. And the feedback will be very, very personalized. Anybody who's been through the academy, or anybody who's even worked with us, knows I'm a stickler for detail. It's a bit of a thing I have. Sometimes a bit too much, maybe, but it's also a strength, and I think that strength comes out in our academic side, where we really focus on small details, because they can add up and make a big difference.
Thank you, sir. Sir, may I ask one more question?
Yes, of course, Muzammil, please go ahead.
Sir, can you walk us through the process of how Hive Medical Academy supports student and securing an NHS job?
Yeah, okay. So the process is, number 1, get in touch with Hive. Tell us where you're up to in the journey, whether you are early, whether you have finished your PLAB route, whether you have tried, securing an NHS job unsuccessfully, or you haven't tried. Wherever you are, just get in touch. We will start the conversation. And then, as I don't want to repeat myself too much, but as I have said previously, that it's a number of steps that are, all of which are important. So it's understanding where to create your job profile, which websites should you be looking for jobs, where should you be looking for the jobs, which jobs you should be applying to, which grade, which role, which specialty, based on your own experience, and based on your own preferences as well, to a certain extent. And then boosting the how you sell yourself on paper in terms of your CV and your cover letter. Then how you sell yourself in person, in terms of interviews, and of course, through the whole process, shortlisting and beyond. And I've already mentioned clinical attachments already, but again, that's a really important part of your journey to getting an NHS job, is actually experiencing what it's like working in the UK, and then putting that experience on paper, and then bringing that experience out in your interview as well. So it's a whole lot of steps. There are many, many steps, more steps in some ways than just the PLAB exams, because there's so many other things that need doing, and it's, unfortunately, it's an area that isn't spoken about enough. There's a lot of negativity out there about jobs, but we're a positive organization, and we prefer to be optimistic.
Thank you so much for your kind response and guidance. Thank you so much, sir.
Thank you, Muzammil.
Assalamu alaikum. So, my question is regarding Hive Academy. that what kind of support systems are in place for students who are facing challenges or any difficulties during their time at Hive Medical Academy?
I was muted. Now I'm unmuted. Great question. Thank you for that question. As I mentioned before, it's a difficult journey, and the difficulties are not just academic. Yes, the exams can be difficult. The other steps can be difficult, visa application, GMC registration, etc. But we also realize and appreciate that the whole experience can be difficult, leaving your country, leaving your family, going to a strange place, learning a new culture, learning, even the subtleties of communication. All of these things can be very anxiety provoking. And, myself, Dr. Shakil in particular, I would say is very, very good at the pastoral support side of things. Anybody's having any issue whatsoever. Usually, if it's an academic issue, they come to me. And usually, if it's any other issue, they can contact Dr. Shakil or anyone else in the team who they feel comfortable with speaking to, myself included, about what their issue is. And when somebody joins Hive, we don't just see them as a student, as a candidate, who is just another number who's going to pass through our courses. We actually see them as a member of the Hive family, and we treat them in the same way. We treat them like family. And so I don't think I can say anything more than that in terms of how well we try to look after people.
That's great. Another question regarding that can you tell us more about the mentorship programs at Hive and how it supports the students in achieving their goals?
Yeah, absolutely. Yeah. So mentorship is a key part of all of our academic programs, in particular the PLAB route. Um, Dr. Shakil has done the PLAB route himself. He was an IMG, so he went through the journey. He knows how difficult it is. As I said, that puts him in a fantastic position in terms of offering support um, to the people who join Hive, and anything they might have experienced, any difficulties he's probably experienced himself. So that's a great type of mentorship to have. On the other side of things, I myself was an OSCE examiner for almost 10 years, as well as being involved in written exams as well. So, and teaching and training. And so I understand what the system is looking for and what the candidates, how they need to perform and what they need to demonstrate. And that comes through in our courses. And so with me being very personally involved in the academic side of things, that mentorship is there, available at any time. And as I've said, they have our personal numbers. They can contact us at any time, and they do on a daily basis. So I think it says a lot about an organization if your CEO and your managing director and your academic lead, the most senior people in the organization are accessible to anybody at any time. I think that's the best example of mentorship.
Yeah, that's great. My queries are pretty clear now. Thank you. Thank you so much.
Thank you, Momna.
Hello, everyone. Am I clearly audible to you?
Yes, Faisal, we can hear you very clearly.
Okay. Sir, I have a question to you. How does Hive Medical Academy's curriculum align with the PLAB exams and NHS requirements?
Great question. So our curriculum aligns with the GMC UK MLA blueprint. It used to be called the PLAB blueprint, but now there's just one blueprint for both the UK MLA and the PLAB exams. So it was put together personally by myself and Dr. Shakil in terms of looking at the blueprint requirements, looking at the changes over the last 2 or 3 years. And so everything we do is matched to that, and everything we actually teach and deliver and talk about is all about passing your exams. But even more than that, it's about keeping the end goal in sight, which is, I hope for all the students who join us, is not just to pass your exams, but to be a good clinician in the UK, and to be a clinician who fits in with the system, who thinks in the right way, who speaks in the right way, and who feels, who doesn't feel out of place, or who doesn't feel, kind of like they are in a strange system that they don't understand. So everything we do from the very beginning aligns with the UKMLA blueprint, the most up-to-date one, which came into which took over the PLAB in 2024 and 2025, and we try to bring that knowledge into practice as well when they eventually get to PLAB 2, about how to be a good doctor as well, not just how to pass your exam.
Great. Sir, I have another question as well. What kind of resources does Hive Medical Academy provide to its students, including study materials, online resources, and practice exams?
Great, thank you. So I think we provide as many resources as you might possibly need in various different formats. If you if you're a visual learner, we've got video lectures. If you like to learn when you're on the go, you're at the gym, you're driving, running, cycling, whatever, we've got audio only lectures too. And then in addition to that, we have our revision notes, which are our flashcards, which are there to help you in case you need some guidance with making notes, or you just want to cover material quickly. We have for PLAB 2, we have many hundreds of cases, PLAB 2 cases, and that you can actually use to practice, as well as use to kind of see how you should approach the cases, what you should be speaking about, how you should be speaking. And then for PLAB 1, we have around 5,000, more than 5,000 multiple choice questions, many timed mocks. And then for PLAB 2 as well, obviously that moves then into the face-to-face teaching, which can then also be delivered online as well, or you can, as in live online, or you can access our resources in your own time on our online course. So I don't think there's anything missing, but if there's some new type of resource that's needed, I'm sure we'll develop that as well. I think my answer put Pfizer to sleep.
Yes, sir. Thank you so much.
You're welcome.
Assalamu alaikum, everyone.
Walaikum assalam.
I'm Aisha Batul, and I have some questions from Dr. Sumbal. So let's start.
Thank you, Aisha. Thank you so much. I'm audible to you?
Yes.
Okay,
So my
this is me.
first question is that how does Hive Care balance providing high quality care with the convenience of online consultation, especially for patients with limited mobility or in remote areas?
Okay, that's very good question, Aisha. Actually, specifically as we concerned about the hybrid model, like online model, like most of our like clients with physical disabilities. अब इस तरह से अगर आप ये देखती हैं कि बहुत सारे ऐसे हैं कि जिनको अपनी एक जगह से दूसरी जगह मूव करने में इशू होता है, तो कुछ ऐसे लोग भी होते हैं कि जो ओपन अप नहीं हो पाते, तो उनके लिए ये एक बड़ा अच्छा मॉडल है कि जिसको हम एक ऑनलाइन जो फॉरम पे ले आए हाइव केयर को, और वहाँ पे हम एक्सेसिबल होंगे उनके लिए, टाइम कंज्यूमिंग भी होगा, मतलब इतना ज़्यादा टाइम टेकिंग नहीं होगा, उसमें टाइम सेव हो सकता है उनका, ट्रैवल के लिए उनको जो भी हसल होती है उससे वो जो है अवॉइड कर सकते हैं। तो हाइव केयर का अगर हम हाइब्रिड मॉडल को या ऑनलाइन मॉडल को देखें तो वो ऐसे क्लाइंट्स के लिए सूटेबल।
So I will just add a few more things, Aisha, for that. That was very good question. So the basically aim of the Hive Care is we will reach to everyone. As far as they have got anybody in their village and anybody in their family has got a smartphone, we are there. So they just need to click on the phone and they could have the consultation with us. Either they want the video consultation, they want the audio consultation. We have open for the free consultation. So they don't need to move out of their bedroom even. Even they're in their bedroom, they can't move out of the bedroom. We will provide them same services which somebody could get in the UK or States or anywhere in the world. We will provide them the same sort of the quality and standard of consultation to them. So this is like, bringing everything in a plate to their doorstep.
What a great answer. Thank you so much, sir, and thank you so much, ma'am. My next question is from you, ma'am, that how do Hive Care therapists tailor their psychological therapy approaches to individual patients dealing with issues like anxiety, depressions, and trauma?
ओके, दैट्स अ गुड क्वेश्चन टू। अच्छा, इसमें इस तरह से है कि एवरी पर्सन हैव द डिफरेंट स्टोरीज विद डिफरेंट ट्रॉमास, सो वी हैव टू डील विद द पर्सन बेस्ड और द इंडिविजुअल बेस्ड अप्रोच। इसमें डिफरेंट अप्रोचेस होती हैं साइकोलॉजी में। अगर हम ये देखते हैं कि एक होती है सिचुएशन बेस्ड अप्रोच और एक होती है विजन बेस्ड अप्रोच। तो बेसिकली हम जो सिचुएशन बेस्ड और इंडिविजुअल बेस्ड अप्रोच होती है, इसमें हम वो यूज़ करते हैं क्योंकि हमने उस टाइम पे उसको एनालाइज करना होता है विद द हिस्ट्री ऑफ द क्लाइंट and with the issue exactly what's the client is suffering from and what's going like on in the background। तो हमें ये सारी चीज़ें देखने के लिए हमें एक पूरा मैनेजमेंट प्लान होता है, वो इंडिविजुअली एक सेपरेट बनता है। देन हम जो है उसको जो है वो कैटर करते हैं विद द प्रॉब्लम।
Thank you so much, ma'am.
जी जी।
Okay, ma'am, my next question is also to you. What are the benefits of Hive Care's hybrid model, offering both online and in-person therapy sessions, and how do patients choose between these opinion options?
ओके फाइजा, जिसमें हाइब्रिड मॉडल के बारे में अभी डॉक्टर शकील ने बताया था कि हम तो दो स्टेप पे भी जो है वो हम इसको जो है लॉन्च करना चाह रहे हैं। तो उसमें ये है कि हम पेशेंट को बहुत सारे ऐसे पेशेंट्स हैं कि जो मतलब फिजिकल किसी भी डिसेबिलिटी के साथ हैं वो लेकिन वो ऑनलाइन कंसल्टेशन जो है वो उसको कर सकते हैं। लाइक उसमें हमारे जो वेबसाइट्स हैं उसके ऊपर हमारे कंसल्टेशंस के जो है वो बटन्स अवेलेबल हैं, वहाँ पे कोई भी इजीली बुक कर सकता है। हमारी 24/7 टीम है जो बैक पे अवेलेबल है, तो आप उस पर कांटेक्ट कर सकते हैं। हाइव के जो भी सपोर्ट टीम है, आप वहाँ से कंसल्टेशन बुक कर सकते हैं। तो हमारे फॉरम से कहीं से भी जो है वो 24/7 आप पाकिस्तान से या ऑल ओवर द वर्ल्ड जो है वो आप उसको अपनी कंसल्टेशन जो अपना आपका जो रेलिवेंट क्वेरी है, जो कंसर्न है, आप उसको बुक कर सकते हैं।
I will just add
Okay.
a few more things, Faiza. Basically, hybrid and digital model is we don't want to discriminate anyone. We don't want anybody. We believe at Hive Care that best health facilities is the right of everyone. Every human being, they should get the best facilities. So that's the reason we have got everything. Like somebody who wants to have a face-to-face consultation, yeah. Somebody wants a home visit, our team could go and visit. Somebody wants just over the phone, yeah, they can do it. The video consultation. So we are trying to cover all aspects of facilities which could be provided to all the people around the world, to avail their best healthcare facilities. So that's basically. So we are trying to make it very, very easy and simple. Either they want to go on our phone website, just click on, they want to book the consultation, what sort of consultation they want. Either they want just the medical consultation, which could be anything and everything. That could be starting from your minor illness, cold and flu, or that could be the long-standing chronic disease. That includes diabetes mellitus, hypertension, ischemic heart disease. Are they suffering from stroke or post-stroke care? Are they some suffering from any cancer? Post-cancer things, anything and everything. We have got the doctors, healthcare professionals around the world on our network who will be available to provide support, care, and guidance and proper advice. And we could suggest, all sort of the investigations too, what sort of investigation they need and what they don't need it. The beauty of our consultation, our doctors they are well trained from abroad, like states and like UK NHS. trained clinicians, and they work according to their guidelines. Like somebody who trained in the UK NHS, they will be have experience according to good medical practice. So they will be treating everybody the way they want to be treated. They respect everyone that they want to be respected. So this is the beauty of we don't either somebody is at home or somebody is coming for face-to-face consultation, or they want home visits from our team. They will be treated in the same way where they will get top standard, high standard care at home or wherever they are.
Great, thank you so much. My second question for Ma'am Sumbal.
Yes,
Why
please.
does Hive Care emphasize emotional well-being, and how does psychological therapy contribute to overall healthcare?
Pfizer psychological therapy is a very important part of like our healthcare system. If we can say, इसमें ये है कि बहुत सारे ऐसे clients हैं कि जिसमें मतलब उनको behavioral issues के साथ वो suffer कर रहे होते हैं. अगर organizational level पे अगर हम ये बात करें तो वहाँ पे भी organizations में जो हमारा employee हैं वो अपने mental health की बहुत सारे ऐसे issues होते हैं जिनको वो जो है वो speak up नहीं करते. Psychotherapy बहुत ज़्यादा important है. यहाँ पे सिर्फ ये नहीं है कि कोई सोशल स्टिग्मा है कि अगर हम इस बारे में बात ही नहीं कर सकते. वी हैव टू टॉक अबाउट अवर मेंटल हेल्थ इश्यूज. हमें इन बैरियर्स को खत्म करना होगा. तो उसमें साइकोथेरेपी बहुत ज़्यादा एक इम्पोर्टेंट रोल है उसका. उसमें हम डिफरेंट जो है वो क्लाइंट सेंटर्ड जो अप्रोचेज है, जिस तरह मैंने पहले भी जिक्र किया, उसका हम यूज करते हैं. देन हम जो है प्रॉपर एक असेसमेंट के थ्रू जो है वो साइकोथेरेपी का प्लान बनता है, इंडिविजुअल मैनेजमेंट प्लान. वो चाहे ग्रुप थेरेपी है, चाहे वो इंडिविजुअल थेरेपी है, चाहे वो फैमिली थेरेपी है, तो वो उसके अकॉर्डिंग सिचुएशन बेस्ड जो है हम एक प्लान मैनेज करते हैं. पूरी टीम उसको जो है वो फिर जिस तरह से एज पर नीड जो होता है हम उसको प्रोसेस करते हैं. लाइक जिस तरह अगर ग्रीफ काउंसलिंग है तो उसमें टीम डोर स्टेप पे होम विजिट भी हम उसको दे सकते हैं कि अगर किसी को बेवरमेंट और जो ग्रीफ के लिए काउंसलिंग चाहिए तो होम विजिट में हमारी पूरी टीम है जो कि फैमिली की जो थेरेपी के लिए वहाँ पे जाके साइकोथेरेपी का प्रॉपर प्लान बना के उनके साथ मैनेज करते हैं. इसी तरह से
Okay,
ऑर्गेनाइजेशन.
thank you so much. Okay, thank you, ma'am. Thank you so much.
Sure.
Assalamu alaikum, ma'am. I have a question for you.
Please.
How does Hive Care ensures that patients receive trusted and expert medical advices through their consultation, whether it's online or in person?
It's a very important question. Like Hive Care must ensure it's a trusted. We are trusted partners for your mental health and physical health. सो अगर आप ये देखें, बहुत सारी ऐसी फ्रॉडल एक्टिविटीज़ हैं सोसाइटी में, बहुत सारी ऐसे प्लेटफॉर्म्स हैं, फोरम्स हैं जहाँ पे हम किसी को यहाँ पे भी डिस्क्रिमिनेट नहीं करते, बट समटाइम्स होता है कि बहुत सारे लोग हैं कि जो डिसअपॉइंट भी होते हैं. बट वी इंश्योर कि हमारी जो एविडेंस बेस्ड अप्रोच होगी, हमारी हम जो है विद एविडेंस विद थ्योरेटिकल बैकग्राउंड के साथ जो भी हमारी जो अगर जिस थेरेपी के ऊपर हम काम करेंगे वो भी इंश्योर्ड है. देन आवर टीम इज ट्रेन्ड विद लाइक हमारे पास इंटरनेशनल एक्सपोजर है, हमारी इंटरनेशनल टीम है जो इसके ऊपर काम कर रही है. तो हम एक ऐसा उनको फैसिलिटीज और सर्विसेज ऐसी प्रोवाइड करेंगे कि जो कि इंटरनेशनल स्टैंडर्ड की होंगी, लाइक NHS स्टैंडर्ड. एज यू नो, NHS इज लाइक ग्लोबली रिकॉग्नाइज्ड. सो वी इंश्योर कि हमारी टीम भी उसी तरह से जो है वो पाकिस्तान में भी और बाकी कंट्रीज में भी जो है वो इसको हम इसको इनेबल करें ताकि हमारी सर्विसेज जो है ना वो उसी स्टैंडर्ड की हों.
And I have one more question, that what range of medical conditions do Hive Care's NHS trained doctor typically handle, from like minor illnesses to chronic diseases management?
Yes,
Yeah.
Yes, Dr. Shakil, please.
Yeah, I will answer that question. Yeah. Yes, Faisal, we have got anything and everything. If somebody is coming with a minor illness, either they have got just a cold and flu, or there's somebody just want to talk to us. Either it's a secure, confidential sport, or somebody just want to say hello to us. We are here. Or somebody is suffering from major medical illnesses that could be chronic rheumatoid arthritis, or you have got diabetes, ischemic heart disease, stroke, post-stroke, or cancer, or somebody post-surgery or before pre-surgery. Anything and everything they think they have concerns. Like what we are here in Hive Care, anybody has got any concern relating their physical well-being or mental well-being. We believe both our physical and mental well-being both are very important for their healthy living and healthy lifestyle. So anything they are concerned, just give us a shout. We're here for them, guide them, support them, and give them the proper guidance and advice. What are the next steps? So in our consultation, we listen to patient. We listen to them. What are their worries? What are their concerns? What are their expectations? And how we could take all their worries away and how we could meet their expectation. We are not going to, none of our consultants are going to request the hundreds of investigations and, without knowing, we will find out the problem, we'll diagnose it, and then we'll treat it properly, like we do in the States and like we do in the UK, like we do in the NHS. So anybody has got anything and everything, Hive Care is for them. Any concerns, either you are at home and you think your cold and flu is not going away, give us a shout. We're here for you to tell. You just want to talk to us like you have got exams coming up, you're anxious, or you have got any other stress. Are you worried? I wish you're going through some bereavement, you have got anybody died in the family, give us a shout. If you think anybody, you are caring for somebody, like you have got elderly parents, or you are, looking after somebody and you are tired and you want to know more, you want to discuss with us, give us a shout. We have got solution for everything and anything. So Hive Care is there.
Okay, perfect. That sounds so assuring that Hive Care would always be there. Thank you so much for your answers, sir and ma'am.
Thank you.
Assalamualaikum. My
Walaikum.
questions are for Dr. Sumbal.
Yes, please.
How does Hive Care tailor its medical consultations and treatments to meet the specific need and preferences of each patient?
And thank you, Momina. I think, yeah, thank you for the question. It's a great question. Like at Hive Care, we treat everyone as a human being, like us, and we treat them the way we want to be treated. So as we said, we try to understand their understanding about the problem. We explore the issues, we listen to them, and we try to understand their expectation, what they want from this. And after that, whatever their requirements, what are their needs, we provide them the treatment advice, investigation advice, or the care according to the international standard. Why it should be done, like if somebody is coming with some hypertension, there are specific guidelines how and when you can diagnose. The first step is important according to good medical practice. We go for the history taking, we complete the history, and then we think that if there are any investigation required, we have got our credible labs with us. We request their investigations, we get their investigations, and we give some responsibility to patient as well. We don't straightway label anybody, any patient with coming first consultation as, oh, you have got high blood pressure. So we advise them, we ask them, we try to change their lifestyle, and then we, if want to start the medication, we will start according to the guidelines, according to the NICE guidelines. So we provide services specific to individuals. We treat them according to their requirements, according to their disease aspects, or according to their needs. We don't just randomly give the same treatment, same investigation for all the patients. So every individual is, for us, is a human being. We have a holistic approach, and we treat them the way we want to be treated.
Thank you, sir. That was really helpful. So my next question is that in what ways does Hive Care aim to simplify and personalize healthcare for its patients globally?
But the simplified is like, in digital age, everything has evolved, everything has changed. So we are trying with the Hive Care that bring the international facilities, healthcare facilities at their doorstep. We believe at Hive Care, the best educational and healthcare facilities, everybody's right. In today's age, everybody should get it. So if we try to do it going, taking the hospitals to the door, it will be hard. But this is the Hive Care is the way where we can take the international standard care to their doorstep. We have simplified. Anybody have got a smartphone, we are there for them. If they don't have anybody in their village, anybody in their family has got a smartphone, just we are just one click away, and you will get your UK standard, your state standard medical care advice while you're sitting in anywhere, any corner of the world. which is hard, especially in the remote areas, especially in Pakistan and the Kashmir remote areas. If we look at the statics, they don't have any good hospitals. They don't have any secondary hospital. Forget about the tertiary hospital. So 50 to 80% patient while traveling from their village to the major hospital, they die on the way. Even for a basic, simple investigation, a basic good advice, they don't have any specialist there. Basic advice, while they are on way to go to another city to get the advice, they die on the way. So Hive Care will bring a revolution. If you're sitting anywhere in the remote area, anywhere, village, either it's the Kashmir or it's the northern areas of the Pakistan, you're sitting there, you have got internet and you have got smartphone. At least you will get the proper, honest, and professional advice of UK standard, of state standard. So this is how we have simplified the care for the people around the world.
That's amazing. And my last question is, sir, that what benefits do patients gain from consulting with NHS trained professionals through Hive Care compared to the other healthcare providers?
That's very good question. And why they should join the Hive as well. Your unlimited benefits, right? Unlimited, like, this digital age, everybody want facilities at their comfort zone. Everybody's busy. One thing that, they want care at their own comfort zone. So Hive Care will provide them. Secondly is the traveling appointments. So they don't need to travel anywhere. That will save their travel expenses. And most importantly, if we look around in developing countries, including all the developing countries in subcontinent especially, even spending huge amount of the money waiting for the appointment, going into the hospitals, either the private hospital or state hospitals, they still don't get international standard or good advice, or good care, or good medication. And we get calls from the patients almost every day from everywhere. They go to the doctor, and the doctor will spend 5 minutes, 10 minutes, would not examine them properly, and even they charge them thousands of rupees, and they'll give them 5, 10 medications and 10, 15 investigations. That's not the right way. We don't do that way. The Hive Care, we work according to good medical practice guidelines. We listen them. And if there is something required, only then we do the investigations. Otherwise, we don't do any investigation. We provide the proper advice and we try to find out the problem. If we don't know the problem, we don't give any medication. So the beauty is we just explore, we listen to them. And importantly, we make a shared decision. Yeah? If they're sitting at home, we will tell them, okay, yeah, these things are normal, this could be happen. And most important thing in subcontinent which is missing is the patient education. The patient education is 50% of the treatment plan. If patients are not well educated about the problem or disease, then they will lack the awareness and they will suffer more. Like if somebody is giving them antibiotics, they should ask why you're giving me the antibiotics. They should ask the question, if I'm suffering from the hypertension, what is the reason and what should I do? What sort of the food I should take and what I should not take. These are the responsibilities in any consultation. There are two types of responsibilities. One is the patient or healthcare provider's responsibility. One is the patient's responsibility. And patient education. If we don't educate the patient, they will never get better. They will take the medication, but if they're not improving their lifestyle, they're smoker, they're drinker, they're not healthy lifestyle, their hypertension will never go away. They will get worse. So patient education is more important, and Hive Care, we focus on patient education. We make them independent and we empower patients to become the independent and they could look after their health better than anybody else.
Yeah, that's all from my side. Thank you so much, sir. Thank you.
Hello, sir. I have a question.
Yeah.
Sir, how does Hive Care see the future of healthcare evolving, and what role does the organization plan to play in shaping global healthcare delivery?
That's the great question. This is the aim of as we said, the Hive Medical Academy has evolved and we're expanding, we're adding our wings, and future we'll be adding much more wings. Hive Care is one of the wing of Hive Medical Academy, and the aim is we will bring a revolution. We'll try to bring the best care at the doorstep of every person around the globe. and we're providing top standard care at their doorstep. That is the big revolution. They need just one smartphone and one click away to get the best advice. Most importantly, we are bringing physical and mental well-being. Mental health issues, they are like silent killer. They are silent killers. So many people, they suffer from them, but they can't speak to anyone. They're scared of things. They don't have that security that, oh, if I'm going to discuss this with my family member or doctor, is it going to be confidential? Or what they will think about me? Or if they think, I'm suffering from anxiety, they think, oh, I'm mad, I'm this and that. Is just sort of the stigma. So we are going to educate people. Usually we say that it's okay to say I'm not okay. This is very important to understand. Your mental health is as important as your physical health. So bringing a revolution, bringing the mental health care and physical health care together at the doorstep of every person, providing them the international standard care, either is minor medical illnesses, or is the mental health illness, either is the general anxiety, or is the post-traumatic stress disorders, or is the bereavement, or somebody, they are the carer, they're looking after somebody for a long time and they're fed up of it, they need a break, or they need a support. Whatever, either somebody's had a fall and had a fracture hip, and post-op they're worried, either they're going through the financial crisis, either they're going through the divorce, either they're going through domestic abuse, they're going through the domestic violence, anything and everything. Hive care is there, and these are the things in subcontinent we need to highlight it to provide the better care, because we believe every human has got the respect. Every human being, they have got right to live at their standard. Every human being is capable of doing things. It's just to educate them, just to support them, just to guide them. So this is what Hive Care will bring it, and this will be the big revolution in the field of the medical consultations, and in the field of the high in the care providing. Like, imagine if everybody knows their rights. In subcontinent, I don't want to name one country. Patient go to the doctor, they pay them good amount of money. They will never ask a question to doctor. Oh, doctor, you gave me 10 medications. Why you gave me 10 medication? And if you ask the question, doctor say, are you a doctor? I am doctor. Go and take the medication. That sort of the attitude is not acceptable. And this is what we need to teach to patients. This is the patient education, that you have got the full right to ask the question. You have got the full autonomy, you have got the full dignity, you have got full right to ask the question, what's wrong with you? And the doctor who is giving you antibiotics or any advice must justify their actions. So this definitely Hive Care will bring a big revolution in healthcare services, and inshallah we will make that revolution happen with our team. We're looking forward. We're very passionate, and with the support of all the team and with the help of Allah, we will make that revolution. That's the dream, sort of, like, every human being must be treated with a great dignity, with a great respect, and with the best care facility. These are the basic rights of human being. Mr. Umar,
Inshallah, sir. Thank you so much.
Inshallah. Mr. Umar, you want
Thank
to
you
add
so much, sir.
anything?
Yes, sir. I want to add a few things because as like our clinical wing, जिसमें भी आपने काफी चीजें की थी, उसमें हमारा जो है वो एक why choose Hive Care, उसमें हमारा एक और एकेडेमिया का विंग भी है, लाइक जिस तरह से अभी एनएचएस की और हाइव की डॉक्टर उमर ने हमें कुछ चीजें बताई। साथ ही इस तरह से हम लोग कोर्सेज भी अनाउंस करेंगे, और हम जो है डिफरेंट ऑर्गेनाइजेशंस को भी जो है इसमें हम बेनिफिट करेंगे। लाइक इसमें हमारे डिफरेंट कोर्सेज हैं जिसमें हम शॉर्ट कोर्सेज अनाउंस कर सकते हैं, क्लिनिकल इंटर्नशिप्स अनाउंस कर सकते हैं। उसमें बहुत सारी कैसी लाइक एबी एनालिसिस है, साइकोथेरापेटिक कोर्सेज हैं, सीबीटी के कोर्सेज हैं, DSM-5, साइकोपैथोलॉजी एंड ऑल डिसऑर्डर्स। बहुत सारे ऐसे हेल्थ केयर प्रोफेशनल्स जिस तरह वो हाइव से रिलेटेड अगर वो देखते हैं कि एंड इंटरनेशनल स्टैंडर्ड के जो है उनको सर्टिफिकेशंस जो है वो पाकिस्तान में या बाकी भी कहीं भी कंट्रीज में जो भी हेल्थ केयर प्रोफेशनल्स हैं, इंटर्नीज हैं, उनके लिए बेनिफिट हो सकता है ऐसे शॉर्ट कोर्सेज 3 मंथ्स के। तो ये भी हमारा एक किसी का पार्ट है कि जिसमें हम जो है इसको भी साथ ही अनाउंस करेंगे ताकि लोग इससे भी बेनिफिट लें एक इंटरनेशनल लेवल पे एज लाइक द 1-to-1 कंसल्टेशन।
Thank you so much, ma'am. Now that the time where we end this session, thank you for joining us on today's insightful session where we explored how Hive Medical Academy empower medical professionals through comprehensive lab preparation and NHS career support. We hope this discussion has given you a clear understanding of the dedication, innovation, and compensation that drive in both organizations, shaping the future of healthcare and medical education. Stay tuned for second part, where we explore practical training, pathway, and upcoming plans. Khuda Hafiz, and thank you for listening.
Thank you. Love.
Thank you.